Well, good afternoon, and welcome to Pay Entry's weekly webinar. Today, we're going to be reviewing the various state laws that have been adopted to provide special leave for COVID. If at any time during the presentation you have a question or comment, please type it into the question box. This session will be recorded and will be available on our website. You'll also get a copy of it just by registering for the event. My name's Kathy Graham. I'm head of HR services area at Pay Entry, and I want to welcome you today. We're going to talk about something that gets very confusing for companies now that have employees in multiple states. It is just like a puzzle to keep up with. But today we're going to talk about some of the laws that are being adopted at the state level that make things even more confusing than they already are. So, we know that the federal laws surrounding COVID paid leave have expired. There was the Families First Coronavirus Response Act that expired in 2020, and then the American Rescue Plan Act of 2021, which expired last year in September. And there's been no federal level effort to revive, so I don't think we're going to see any federal legislation on this front in the near future. So because of that, a variety of states and cities even have implemented new paid leave requirements. And they've done this to alleviate the economic strain on employees who are unable to work because of COVID. They're different by state. So that's what we're going to talk about today. Arizona has a leave. This says that employers with 15 or more employees in the state must provide up to 40 hours of paid sick time a year, and that smaller employers must provide 24 hours. Earned paid sick time must be available for the closing of an employee's place of business due to a public health emergency like COVID. If an employee or family member contracts or needs to be tested for COVID, if an employee or a family member is quarantined after exposure, or if an employee needs to care for a child whose school has closed due to COVID or daycare. So that's Arizona. And you have to have 15 employees in the state. So a lot of times we, like at Pay Entry, we have employees all over the United States because we are a remote workforce, and we do have people in Arizona. So we have to pay attention to the laws in each of these states. And of course, we know that California obviously is going to jump on the bandwagon here. They've been on it since the beginning. They have now introduced a 2022 supplemental paid sick leave. This is their third version of the state's paid leave requirements for COVID. This applies to employers with 25 or more employees nationwide. Just to make it clear, just to let you know, there is a copy of the presentation in PDF format in your handouts today on the screen. If you can't download that, or if you'd like to just get it from me afterwards, please just send me an email. So if you have to have 25 or more employees in the nation, not just in the state. So that opens it up. So if you have employees in California and you only have one there, but you have more than 25 employees in the United States, then you have to comply with this. In California, full-time employees get 80 hours of paid leave, and there are basically two banks of time. The first 40 hours is for an employee who is subject to a COVID quarantine or isolation order. They've been advised by a healthcare provider to self-quarantine or self-isolate. They need to go to the doctor to receive a COVID vaccine or booster, or they're experiencing symptoms related to the vaccine or booster that prevents them from working or teleworking. Still in California, they also can be experiencing COVID-19 symptoms and seeking a medical diagnosis, or needing to care for a family member who is subject to the quarantine, has been advised to self-quarantine, is going to the doctor to get a vaccination or a booster shot, or is experiencing symptoms related to the vaccination or the booster. Or if they have to care for a child whose school or place of care has closed or is otherwise unavailable due to COVID. So it's pretty broad. There's an additional 40 hours for any employee or additional 40 hours for an employee or family member who tests positive for COVID. So that's 80 hours total and 40 hours in each bank. Those do have to be tracked separately, and we're not going to go into this today. You can contact your client advocate, but you do need to show the time that they have used on the paycheck in California, not the time that they have available, but what they have used, which is a little backwards, but that's the way the law reads. Also in California, and this is it's the biggest law in the United States as far as these details go. But California says that an employer may limit the paid sick leave for the vaccine or the booster to 3 days or 24 hours, including time to get the shot, unless there's a doctor's note that says that they have continuing symptoms. The maximum that you have to pay is $511 a day. It's paid at the regular rate of pay. And there is no tax credit for this at this point, so it is coming out of the employer's pocket. The cities in California that also have COVID paid sick leave are Long Beach, Los Angeles County, Oakland, and San Francisco. So if you have employees in those cities or the county of Los Angeles, you need to get additional information on their rules, but they pretty much follow the state rules. Let's talk about Colorado. Colorado's an up-and-coming HR a state that we pay attention to because they're getting pretty employee friendly. They have an act called the Healthy Families and Workplaces Act, and under this law, there are two types of paid leave. There is public health emergency leave and accrued leave. All employers are covered under this, so there are no exclusions. And that means if you have one employee in Colorado, that means that you have to abide by this. It provides 80 hours or up to 80 hours of paid sick leave for isolations due to symptoms or diagnosis of COVID, to care for a family member under the same circumstances, to comply with an employer's instructions to stay home after exposure. If you tell someone to go home because they've been exposed or in the workplace or otherwise, and to care for a child whose school is closed due to COVID. That's not as common now, but it does still occur. And Massachusetts is another pretty proactive state in the United States. All employers are required to provide COVID sick leave, but it ends on March the 15th of this year, which is next week. Now, they may extend it. I haven't seen anything on that yet, but just if you're in Massachusetts, keep an eye on that. An employee who works 40 hours a week must receive up to 40 hours of COVID sick leave, and that must be paid. If they're working less hours than 40, then they get a prorated amount. So part-timers do qualify for this. And the pay is capped at $850 a week, so you don't have to pay more than that. It does, however, come out of a state fund, so you will be reimbursed up to $850 a week from the Massachusetts state fund that's been set up for this. Still in Massachusetts, that paid sick leave is available for an employee or a family member who's in isolation or self-care after a diagnosis, or if they're recovering from a reaction to the vaccine. It also is available for an employee or a family member who's under quarantine order by a public health official, an employer, or a healthcare provider to isolate. Nevada has never been a state that has a lot of employee-friendly laws, but they do have a law that says that if you have at least 50 employees in the state, you have to comply with their COVID paid leave law, and that is that you must pay up to 4 hours of paid leave for an employee to get a two-shot vaccine or up to 2 hours for a one-shot vaccine. And it just talks about the employers, I'm sorry, employees, not the family members, as the other states have done. This covers all employees regardless of their status. They can be temporary, part-time, full-time. Um, they are supposed to be given that time. In New Jersey, where they do have a state family paid leave law, um, all employers are subject to this law. And it's their current paid leave law has been amended to allow for use of the state PSL for reasons related to communicable diseases, which would include COVID. It's not specific to COVID though, so there's no expiration date. This could be adopted for other communicable diseases. And New York is a really active state when it comes to laws regarding employees. As far as vaccines go, all employers must provide up to 4 hours of paid leave per injection. This is in addition to any other paid leave available, including the state's paid sick leave. You know, they do have a state funded paid sick leave program. Also in New York, the paid leave is now, in addition to employer provided paid sick leave, already available to employees. So the vaccination leave is on top of that regular paid leave. It's in addition to. Private employers with 100 or more employees, all public employers, and then employers with up to 10 employees and a net income greater than $1 million a year must provide 14 days of paid sick leave for COVID. Employers with 11 to 99 employees must provide up to 5 days of paid sick leave. In New York City, there's also a second requirement that employers provide 4 hours of paid leave for workers to have their children vaccinated, and that's for each vaccination. So if they have 12 kids, it would be 4 hours times 12 kids. This also applies to a child who's experiencing side effects to the vaccination. So if they get sick and you need to stay home with them in New York, this would apply. And you know, Pennsylvania is not big on employee relations laws, but Pittsburgh, Pennsylvania has a law that says that if you have more than 50 or more employees, you have to provide paid sick leave for COVID-related reasons, in addition to the current paid leave that's available. And this is after 90 days of employment. This is effective only through July of 2022. I don't think that this will renew, but you never know. Employees working 40 hours a week are entitled to 80 hours and all others are prorated. Washington, D.C. Has amended their D.C. FMLA law to include COVID leave of up to 16 weeks, and this took effect back in November of 2021. Plus, They have amended it to allow up to 2 hours of paid leave for employees and children to get COVID vaccinations, and up to 8 hours of paid leave for any side effects occurring within 24 hours of the injection, with a maximum of 48 hours per year. They have to have worked for you for 15 days, so 3 weeks. It's an odd time to have to work for a company. You would normally see it at 30 days, but it's 15 days. And it is capped at 48 hours per employee per year, as I mentioned above. Okay, so what should you do? What do employers need to do with this information? Well, first of all, make sure you download a copy of this so you know which states you're dealing with and which rules you're dealing with. And then what you need to do is identify the states in which you have employees working. And there are a lot more now than before the pandemic because a lot of companies have allowed their employees to work remotely. So identify the states in which you're impacted. Then review those laws, because what I've given you here today is just a basic overview. There's fine print in each one of these laws, and so you would need to take the state and then do some research. If you want to call me, I have some state-specific information I can share with you, and we'll be happy to do that. And once you do that, once you identify it and know the laws, there are notices that have to be provided to your employees. It's not something that I would amend a handbook over because it is something that will be temporary, we hope, but it could be an addendum to your handbook, or it could be just a policy and a notice that you provide to your employees to let them know what's available to them and how it should be handled, how they request it, etc. So if you have questions, you need help with any of this, please let me know. You know, one of the benefits of being a pay entry client is that you can access our HR services area um, to ask questions and to get forms. We have higher levels of service that are available, but as a part of your payroll package, you can email me any day, ask me for a form, ask me for a policy, or ask me how to handle something. At the HR services offering that we have, the compliance package, that gives you a way to know that your company's compliant, and it gives you extensive access to us. It gives you a free handbook, a lot of other policies and procedures. So if you're ever interested in that, let me know. I'd be happy to send you some more information. But as a payroll client, you have access to call in and ask us questions and get like a policy or a procedure or a copy of something that deals with your state laws. So if you do have any questions, I'm going to look in the questions box right now to see if we have anything. Um, let's see here. If I have employees working, let me just get this over here. Okay, if I have working, let me read this again. If the employee was tested positive and isolated for 2 weeks with additional symptoms, can they use hours from both Bank 1 and 2, a total of 80 hours? It depends on which state you're talking about. I think California, if you're talking about California, yes, they can also use the state paid sick leave too for that if it's a longer duration of treatment. And please share state and city's rule for employees working in Georgia but headquartered in California. If they are working in Georgia, there are no COVID rules in Georgia. Even though your company is headquartered in California, they would not be subject to that unless the employees are in California. Here I have employees working in other, aside from those that are listed. If they're not listed, does this mean there's no policy in those states? Yes. Right now, there are no state-specific policies in other states like Florida and Georgia and North Carolina, South Carolina. They are not bound by any rules right now. No state legislation. And that looks like all of our questions. If you have questions afterwards, please shoot me an email or give me a call. Um, you can also email hrservices@payentry.com and we'll answer you that way too. But it's been a pleasure talking with you today, and let me know if I can help in any way. We'll see you next Thursday for our next edition of our weekly webinars. Thanks.